Preventing and alleviating stress. When is an itch more than just an itch? An itch is an uncomfortable sensation that causes your dog to want to scratch. While there are many reasons your dog may have a temporary itch, excessive scratching and face rubbing is not normal. Allergic itch in dogs can show up in different ways: scratching, licking, chewing, biting, rolling, rubbing, or scooting. Sometimes allergic dogs have recurrent ear problems that cause head shaking, discharge, odor, or scratching at the ears. Allergic skin disease may also result in hair loss, body odor, rashes, greasy skin, or scabs. Itchy allergic skin disease is one of the most common reasons that pet owners seek help from veterinarians, and if left untreated, chronic itching can result in stress for your dog. Dogs may itch because of allergies to food, fleas, seasonal pollens, molds, or dust mites. These triggers set off a cycle of itching that can lead to skin infections, more itch, and greater irritation. It can be a frustrating situation. Treatment that provides itch relief can break the cycle and help irritated skin heal. If your dog is stuck in the itch cycle, his discomfort can start to interfere with the bond you share. Itchy dogs are often up at night, keeping everyone else up with them, or their skin smells so bad that they are banished to separate rooms and kept away from the rest of the family. Owners are often desperate for a solution, trying remedies that are doomed to fail. Some will try up to 15 over-the-counter products, including antihistamines made for humans. Owners have tried covering inflamed, irritated skin with a t-shirt, giving dogs oatmeal baths, or changing to grain-free food. These changes won't work to treat allergies in dogs. The itch cycle continues, the dog remains in discomfort, and the owner's frustration grows. The best plan is to talk to your veterinarian. There are medications designed to provide fast and safe itch relief. Breaking the itch cycle reduces the stress your dog feels and helps your family get back to normal. Catching allergic skin disease early is important for your dog's health and quality of life. Visiting your veterinarian as soon as you notice a problem is always a good idea. She can determine if the skin problem your dog has is in fact due to allergy, or if it is something that requires a different treatment like infection or parasites. After a thorough exam, your veterinarian can recommend ways to relieve the itch immediately and during the time it takes to figure out what is causing the itch. It is helpful to use a chart to track your dog's level of itch. Taking an observation like, "My dog is itching," and changing it to a number out of 10 that you record every day makes it much easier to describe your experience to the veterinarian during your dog's examination. Keeping up your itch tracker will also help you watch improvement over time. The reality is that very few dogs with allergic skin disease get 100% better. Flares are expected in dogs with allergic skin disease and can be caused by many different triggers, including flea bites, unintentional access to foods that cause allergies, and seasonal increases in pollen counts. Trying to keep your dog on track by monitoring his itch behavior helps alert you to flares and keep him off the emotional roller coaster of itch. Meet Toby. Toby's owner found that he would spend 2 hours rubbing his face on the bedroom carpet each morning. On the itch scale, Toby's face rubbing started out as mild. Over time, it became moderate and eventually severe when he was at the point of rubbing his face for 2 hours a day. Even though his itching is severe, Toby's skin isn't obviously raw or inflamed. He doesn't have open sores or infected skin. He isn't missing any fur. Toby's owner made an appointment with the veterinarian. She gave Toby an oral medication called Apoquel right in the exam room. Apoquel starts relieving allergic itch within 4 hours. Important safety information for Apoquel. Toby's veterinarian completed a workup to determine the cause of his itch. She ruled out parasites, infection, and food allergy. The final diagnosis was atopic dermatitis. This is a lifelong disease that causes inflammation of the skin. It can flare when allergic dogs are exposed to triggers. Apoquel provided immediate relief for Toby so that the veterinarian could diagnose his condition. It continues to provide relief as part of the long-term management plan for Toby. Without all the itch, Toby's stress has decreased and he sleeps in. Meet Roscoe. Roscoe's itch started at 7 months old. It was so severe that his owner rated it a 10 out of 10 on the itch scale every day. Roscoe was fitted with 2 Elizabethan collars and 2 pairs of socks to prevent him from traumatizing his skin. Without these precautions, Roscoe would chew his feet raw. The veterinarian was able to determine the cause of Roscoe's itch and provide long-lasting relief with a medication called Cytopoint. Cytopoint is an injection administered by the veterinarian that lasts from 4 to 8 weeks. It treats allergic dermatitis and atopic dermatitis. With Cytopoint, Roscoe's quality of life increased dramatically. He was able to forget the itch and spend more time with his people. We know that allergic itch can cause stress and interfere with the bond you have with your dog. Here are some tips to make things better. Seek immediate help from your veterinarian. Track your dog's itch level in preparation for the appointment. Request relief from allergic itch for your dog. Stay in contact with your veterinarian and report flares right away. Medications like Apoquel and Cytopoint can be used to relieve itch from allergic or atopic dermatitis and to manage intermittent flares of allergic itch from triggers like fleas, food, or seasonal factors. With your veterinarian's help, the stress of itch can be a thing of the past, protecting the bond you share with your dog.